Hello and welcome to the Blood and Cancer Clinic for Children, Kanakia Healthcare. I'm Dr. Swati Kanakia, Pediatric Hematologist-Oncologist from Mumbai. If your child is receiving chemotherapy, the doctor has perhaps told you that it's very important to control infections or prevent infections. Now, how do you do that practically? This video explains it to you step by step. So why does a child who's receiving chemotherapy stand at an increased risk of developing neutropenia? So chemotherapeutic agents kill cancer cells, we all know that. But in addition to that, they also end up killing certain normal cells of the body. Now there are different types of WBCs. One is the lymphocyte, the second is the monocyte. Lymphocytes are further divided into T cells and B cells. And then there are granulocytes. In the granulocytes, there are basophils, eosinophils, and neutrophils. And if these neutrophils are low, the child is at an increased risk for infections. Let us look at what we can do to prevent infections. The single most important thing is hand washing or hand hygiene. So whoever is looking after the child or handling the child needs to wash their hands with soap and water, especially before feeding the child and after change of diapers or taking the child to the washroom. The child's hands also should be washed with soap and water. One also has to keep the environment very clean. You don't need a fancy air conditioner. If there is an air conditioner, it needs servicing. Because in a hot and humid country like ours, there are sometimes fungi which are growing in the tubes or in the vents of the AC. Just wet mopping of the floors and of other surfaces is enough. Another thing that one must really watch out for is the food. So ensure that there is boiled water. The food that you make is prepared at home. It is not street food or food exposed to flies, etc. Also to prepare fresh food as far as possible. The doctor will avoid fresh fruits during periods of severe neutropenia, but please talk to your doctor and depending upon the degree of neutropenia, they will advise you what is to be eaten. Also, there is a complete different video on nutrition in cancer. Please watch it. If your child has neutropenia and is roughly 4-5 days or 5-6 days following chemotherapy, you know that the counts are going to be at the lowest. There will be certain danger signals that you have to watch out for. Fever, malaise, that means the child is not playing or is very irritable or is very tired. If the child develops oral ulcers, means ulcers in the mouth, the child has diarrhea, or the child has skin rash, please rush him to the doctor immediately. Sometimes children with neutropenia may not even mount a fever, so watch out for the other symptoms. Constipation is another thing which we are really worried about, and we try and avoid constipation either by giving medicines or otherwise by giving certain fibrous foods. The reason is that there may be difficulty in passing stools, which may give rise to some bleeding, and definitely we do not allow inserting suppositories to help the child pass stools, because in children with low WBC counts, this may be a source of infection. In fact, you would be introducing infection into the body. In addition, we advise chlorhexidine mouthwashes, maintain excellent oral hygiene, brush the teeth with a soft baby brush so as not to cause bleeding, and wash the child's mouth or at least gargle, encourage them to gargle after every meal. Local mouth infections, that is the fungal infections, can be prevented very effectively with the use of anti-fungal agents, in which the tablet is actually meant to be bitten and chewed and not swallowed. The child is also encouraged to take a seeds bath, that means in a tub of water with a little bit of medicine, which we will tell you, the child is made to sit twice a day so that the perianal region remains clean. Doctors would also advise applying betadine to the skin folds, that means wherever skin meets skin, because these are the precise places where bacteria are likely to flourish. One must limit the number of visitors to the child because each visitor will get his set of germs. And completing the list of things to avoid would be fresh flowers, which are brought by well-meaning friends and relatives, and also soft toys, which cannot be washed or wiped daily. Avoid crowds, no going to movie theaters or to the mall or playgrounds. The child can be taken out, but in non-crowded places. Also, if you feel that there is somebody who can benefit from this video, please do share it with them. Subscribe to this channel for more such videos and for more information. Please remember, this is not a substitute for a consultation with your doctor, and you have to be in touch with them at all times.